Hello, this is Dr. Kim Jeong-il. Today, I will review my thesis. This is the thesis where I received my fee under Professor Sato. This paper is about the relationship between the vertical dimension of occlusion, the inclination of the occlusal plane, and the anteroposterior occlusal relationship. Many doctors already know that vertical dimension is important. They have evaluated vertical dimension primarily for anterior vertical dimension. However, the posterior vertical dimension is also important in the dentition. Thus, the posterior vertical dimension can affect the anteroposterior position of the mandible, which allows us to know how the mandible adapts during growth. Insufficient vertical dimension can be said to be the causative factor of skeletal malocclusion. However, there have been few studies on the vertical height of the teeth and the inclination of the occlusal plane. So, in order to understand the relationship between the vertical dimension and the growth of the maxillofacial complex, it was necessary to evaluate the dental and skeletal factors. When a baby is born, only the head is large and the mandibular area is small. As the lower face grows gradually with normal growth, the occlusal relationship becomes class 1 in an anteroposterior direction. To evaluate this, a longitudinal growth sample was studied. This is a research paper through the lateral ceph, a model of 25 children from 6 to 14 years old. At this time, the initial and final stages of Hellman dental age 3 and the stage of permanent dentition were studied to evaluate the occlusal and skeletal conditions. In general, we know that class 1 occlusal relationships are formed through the leeway space. This leeway space is the final step in Hellman dental age 3. Dental occlusion can be classified into class 1, full class 3, half class 3, half class 2, and full class 2. The skeletal pattern can be classified through ODI, APDI, and CF. APDI is the best method for evaluating anteroposterior condition. The APDI for class 1 malocclusion is 78 to 84, class 2 is below 77, and class 3 is above 85. These are the measurement points used in cephalometric analysis: the angle between the FH plane and the mandibular plane, the vertical distance from maxillary first molar to the palatal plane, vertical distance from mandibular first molar to mandibular plane, vertical distance from cellar to palatal plane, AB plane, A point, B point, GOP, AOP, POP, ODI, APDI, and so on. It can be classified into 4 types according to the growth stage. The first stage, in which permanent dentition begins to form, is the time when the maxillary and mandibular first molars erupt. The timing of exchange of buccal teeth. It is the time of exchange for leeway space, the last stage of Hellman dental age 3. Next, it can be classified as a final stage. The first conclusion is as follows. We investigated the change of dental and occlusal conditions during growth and development. In the initial occlusion, 52% had a class 1 molar relationship. As it grows, 52% of this can be changed to class 1, class 2, or class 3. In the last occlusal state, class 2 had 38%, class 1 30%, and class 3 32%, which had a similar distribution, but among them, class 2 was the most common. At this time, we looked at how the state of class 1 changed. In the initial occlusion, the Hellman dental age 3 is maintained at the initial stage. But the occlusal relationship changes as the state of Hellman dental age 3 is reached. At this time, 42% of them were changed from 1 to 3. And 38% were maintained from 1 to 1. Interestingly, the condition that was class 2 malocclusion was not changed to class 1 in spite of leeway space, and remained as class 2. How has class 2 malocclusion changed? Class 2 malocclusion was first class 1 or 2. Class 2 malocclusion was 15 in the early stage of 3. That is, around the age of 8, and it remained almost the same, and finally reached 14. In other words, at the age of 8, the condition of class 2 malocclusion did not change even during the leeway space as it grew. There were not so many patients with class 3 malocclusion, but there was only one patient, and it was maintained as class 3. In other words, around the age of 6, patients with class 3 remained at class 3. This is the conclusion of the first result. The occlusal condition of class 1 children who are growing up was decided earlier than we thought. At this time, at the initial stage, there was a tendency that the class 2 molar relationship remained at class 2 during growth. In other words, leeway space did not seem to play a very important role in forming class 1 at the time of exchange during mixed dentition exchange period. Therefore, it was possible to think that not only leeway space, but also some other factors could influence the class 1 occlusion. So early orthodontic treatment is essential to prevent malocclusion. The second result was to measure the relationship between vertical dimension and occlusal plane inclination. A PDI makes it easy to classify dental occlusion and skeletal condition. This is the vertical height of the upper and lower first molars. There was no significant difference in the classification of dental occlusion. However, in class 2 malocclusion, overruption of the mandibular first molar was observed between Hellman dental age 3 and the last stage of Hellman dental age. That is, between 8 and 12 years of age. On the other hand, in class 3 malocclusion, it was observed that the maxillary molars were overrupted around the age of 12, when the occlusion was completed. Both of these will be important factors in your treatment. In other words, it is necessary to control the overruption of the mandibular molars to treat class 2 malocclusion, while it is necessary to control the overruption of the maxillary molars to treat class 3 malocclusion. Let's look at the malocclusion and the anterior growth of the maxilla and mandible. In class 2 malocclusion, there was no significant difference in the growth of the maxilla. But there were many cases where the growth of the mandible was insufficient. When examining whether the maxillary is protruding or the mandible is retruded, it is consistent with the conclusion that there is more mandibular retraction in class 2 malocclusion, similar to recent papers. there was no significant difference between the vertical height of the palatal plane and the total vertical dimension. There was something that stood out importantly here. There was a difference in POP between Class 2 malocclusion and Class 3 malocclusion. Steep POP was shown in Class 2 malocclusion and flat POP in Class 3 malocclusion. However, the anterior occlusal plane and GOP showed no significant difference. This is the conclusion of the second result. There was no significant difference between the vertical height and occlusal plane in the dental classification. However, there were differences in the skeletal classification. In Class 3, the maxillary posterior teeth were more overrupted, and in Class 2 malocclusion, the mandible posterior teeth were more overrupted. In addition, in Class 3 malocclusion, flat POP, and in Class 2 malocclusion, steep POP were shown. Also, the increase in vertical dimension might have an effect on the anterior growth of the mandible, not the maxilla. Next, the relationship between the vertical dimension and the anterior growth of the mandible was evaluated. In the first case, the mandibular first molar becomes increased overruption, even if the mandibular first molar becomes overrupted. The vertical dimension also increases, so the mandible B point comes out slightly forward. In these cases, there is a weak correlation. When maxillary first molar is extruded, it is closely related to the anterior growth of the mandible. The highest point here is the increase in total vertical dimension. In other words, to treat Class 2 malocclusion, it means that the total vertical dimension must be increased for the B point to come forward. Many doctors said that because of the leeway space, they become level 1. However, in this paper, one of the other causes of Class 2 malocclusion and Class 3 malocclusion is to increase in vertical dimension and posterior occlusal plane inclination affect mandibular growth. You can think of it as a Class 2 relationship. If the vertical dimension and POP are adjusted incorrectly, it means that there is a high possibility of developing skeletal malocclusion. In normal Class 1, the upper molars are erupting downward and the mandible fully grows forward. On the other hand, in Class 2, the anterior growth of the mandible is insufficient and the occlusal plane may differ. Therefore, when the Class 1 relationship is formed, the size difference between the primary molars and the permanent teeth, that is, the leeway space as well as the mandibular adaptation, such as how much the mandible grows forward, may make a difference. This is the conclusion of my thesis. In growing children, Class 1 molar relations have already been determined in the early mixed dentition stage. That is, after the eruption of the first molar and before the mixed dentition exchange period. In order to obtain a Class 1 occlusal relationship, the vertical dimension is sufficiently increased, and making the mandible position forward is more important than the leeway space adjustment. At this time, the inclination of the occlusal plane, or POP inclination, may cause skeletal malocclusion. Therefore, to prevent skeletal malocclusion, we must keep it in mind that early adjustment of the vertical dimension is necessary. Thank you for watching.